Hello, everybody.
Hi, good evening. We are live again.
Looks like everybody else is live too. We've had about 10 notifications of colleagues who are starting to go live.
Well, first of all, how are you? How are you all feeling? It's almost becoming the new normal now, this lockdown. And we're going to talk about questions that you might have after an unsuccessful primary rhinoplasty. And thank you so much to all of you who have sent us many questions. And to begin with, we'll try to answer some of the questions, like put them all in a summary, and in about maybe 30 minutes or so, bring the questions in, and then we will reply them as they go along. Proper live Q's and A's. Hey?
Brilliant. Yes. Okay. So we thought about this as a way of helping everyone who is considering rhinoplasty, and what we wanted to hear is basically from those of you who perhaps have not had the best outcome, knowing what you know now and knowing what's available to you, what would you do differently that would help in terms of decision making and picking your surgeon? And one of the things that's been interesting with all the questions is there's been fairly common themes through those. Everyone's got disappointment, let's face it. There's often feelings of regret. A lot of people are feeling quite shameful. And this means that none of you are in a good place. And sometimes that's expressed as anger, sort of hiding, not wanting to be talking about things. It can be, obviously, you're down on money because you paid and you haven't got what you wanted. A lot of people withdraw, but some people also become very, very obsessed and want to kind of control everything from this point forward. So the psychology is quite important in terms of this, and I think it applies to both, whether you're having a first-time operation or having to go through a secondary.
I think Instagram has made such a huge difference, because what's become apparent is that although all of us do our research, what is really important is being able to message patients that have had surgery and get to know how they felt, how was the process, how was the first port of call, did they try to give you a hard sell when you first contacted the office. Another very important thing that has come across is sometimes we think that going to big establishments, you're going to be safer, but big clinics are probably not the best. You don't get to know the surgeon. There is very poor rapport with whoever is going to do your operation. There was an amazing question as, how do I know if my nose is botched? And that is incredible, isn't it? Because
yeah,
a lot of you seem that you go back to the surgeon and sometimes the surgeon says, but it looks lovely, what are you complaining about? And that can be difficult. Sometimes you think, is it all in my head? How can I transmit what I want to say? I enjoyed that question a lot. And one thing is, every surgeon has complications, but in terms of a poor result from your primary, I mean, Charles is an expert at revision, and he put together a presentation some time ago. What are the error patterns in rhinoplasty? So I think maybe you could share a few of those slides that you presented, because that
sure.
I think will help you understand whether it's a complication or whether the surgeon didn't probably do what he or she should have done.
Yeah, so I think I do sympathise with people who say, look, I've been back, I've seen my surgeon, he said, everything's fine, everything's fine. But in your heart of hearts, you know it's not right, and when your friends tell you that, so you sort of have a bit of self-doubt. I think it's really, really important to understand the difference between a complication. Now, that's what we define as an unexpected outcome, and complications are usually things like getting infection or getting bleeding, something to do with the actual physicality of the operation. What happens, why a lot of people don't get a good result in rhinoplasty, is more related to what we call an error pattern. That is, there are technical things that were done or not done in the operation that meant as all your tissues settled, you don't get the nice result that you want. And a lot of the error patterns fall into fairly consistent categories. And it's interesting, lots of people have messaged us saying, you know, we can see error patterns in particular individual surgeons who do operations. So we can sometimes recognize who's done that nose beforehand. And in a way that's a little difficult, because it kind of often says, well, that person's not really developing, they're not having an interest in their outcomes, and if they're getting consistent problems, that's something ideally that everyone needs to know about, really. And that's where I think Instagram comes in, that you can actually direct message people and get something that's first-hand, is not glossed over with websites or marketing, and particularly with the big companies too. And you know, like the other issue is obviously being seduced by price, because that makes you, I think, very vulnerable to be pushed somewhere without perhaps getting to the best people. Lydia might be able to just show,
yes,
if we turn this round, I can show you some of the common error patterns. So what someone asks us the question, how do I know if my nose has been botched? Well, let's just see if this works and see if we can. So you may be able to see that it's some of the error patterns, and then one of my fellows who I worked with for a year put all these pictures together, and these were just a series of noses we had to correct in the phase of a year. But in essence, one of the common problems is obviously the bridge has been over scooped out, and you see this sort of abnormal appearance where the whole thing, just too much has been taken away. So this is the commonest error pattern, is over resection of the bridge. We then see other sort of problems as well, where the bridge is low but the tip is in the wrong position in relation to that. And sometimes the middle part of the nose collapses in, so we have this little inverted V. You may be able to see this on there. There's a little gap between where the middle part of the nose and the upper part of the nose sit, where the frame's destabilized. In terms of the tip, obviously the shape can go wrong. It looks wide, it can look asymmetric, or it's just completely dissociated, like in this, where it looks like it's melting away from the face. So you can see there's a combination of errors here. And that's, I think, one indicator if you have gone through a botched operation, is you usually have error patterns in more than one area. So bridge, position and shape of the tip, whether the tip's hanging down, and then whether or not the cartilages have been over-reduced. Here, this is a bossa. You see the big knuckle on this lady's nasal tip here, onto the side. The cartilage has gone into the wrong shape and it's kinked. Or if the cartilage has been taken out, you get this abnormal rotation and really obvious nostril show. It's really, really important, obviously, to have enough cartilage to support the skin. So any over-resections usually result in these sort of deformities. And then, of course, the next error pattern is if the axis of the nose is not corrected straight, or the septum isn't repaired properly, the nose deviates, or it may collapse if part of it's taken out, and you get this odd, curvy, saddle nose deformity. So those are some of the error patterns that we will commonly see, and those aren't really complications, they're technical problems most times.
I hope that kind of helps you understand yourself, whether you see any of these issues that should not be there. In a way, what I say, normally I say, is like, the best result is when no one can tell you've had an operation. And if other people can see this, something looks strange, that's probably that the result is not right, in case you were doubting it. And some of you have said on the questions here already whether there is someone we would or wouldn't recommend. And I'm sorry, we are not at liberty of giving the names of individual surgeons, either pro or con. So I'm sorry, we can't do that, it'd be unprofessional. But you can certainly, some of you have had the same surgeon, some of the have been ladies that have messaged us, have the same surgeon in common. So maybe amongst yourself you want to share that and see. Typically that person says that he can do the revision, but it's a very quick, easy job under local, and very rarely that solves the problem.
Yeah.
Other questions that have come up, I'm trying to think. There was another really, really interesting one. I mean, lots of you have given it a lot of thought. A lot of you feel that, am I kind of the only person seeing that? And then in that effort to express it, you do a lot of research and you become almost experts in rhinoplasty. It's taken us ages to get to that point, many years, but you seem to become experts at technical issues.
Yeah, I think there's one of the biggest things about this is obviously is dealing with that. It's a post-traumatic stress that happens when you don't get the result that you want, and that's something that is kind of really, really important that you are absolutely au fait. You've got enough information about the person or the team you're going to work with. It's often worth asking, okay, if you can't fix me or there's a problem, who would you send me to sort it out? And then you can ask them, how often they have to do their own revisions. And most surgeons should tell you, they should be auditing their work and looking and seeing what their figures are. So that's quite an important question.
In terms of who to choose, I just thought of something because sometimes I just thought Rockstar. It's true that it helps to see if other reputable surgeons, I think more than famous, follow them. But I thought a lot of patients ask me, how would I choose a surgeon? Knowing what I know, how do I choose? Obviously, I've got inside knowledge and that helps, but I can tell you, I would choose a surgeon that I know he or she will look after me should something not go according to plan. In other words, if something doesn't go right, will he care? Will she care for me? And that's how I've chosen, in fact, my previous surgeons. So when you meet with the consultant, perhaps a good question to ask is, if something doesn't go according to plan, would you deal with it yourself? Would you refer me to someone else? How will I be looked after?
Yeah, I think that's really important. And we see us in some of the messages that have come through, they're saying, well, the person didn't listen to me. So I think one of the key things with a person, if they say, no, don't pay, I know what's right for you and do it, or if it's a person who does lots of different operations in different parts of your body, just be a little bit careful that they may not be listening. We always try and have that sort of reflective listening, that we want to know what your priorities are, you spend time, and if you feel under pressure or at any stage you feel that you're being sort of sold something, then that's usually not a good sign. Not a good sign. What else? What other?
We're just going to check another couple of questions that were very similar amongst all the ones that direct messaged us.
While we're talking about that, and one of the issues about wanting to know what sort of techniques are done, that can be actually quite intrusive onto your well-being, because if you want to try and take control over what's going to happen with an operation, that's actually quite stressful. One of the things, obviously, first is putting your trust in an individual, and then secondly, really communicating what you want as the outcome, because there are many different ways operations can be done. And if you've had a bad experience and you're then trying to work out, well, do you do this, do you do that, that adds a lot of stress. That's things that we need to shoulder, not you. So only just advice in terms of not being too over-researched about technical aspects, because as Lydia said, we've spent years learning, practicing, going through, talking in our little focus groups to try and work out what are the best solutions. So it takes a long time even for us, and we don't always get it right. but we have a pretty good idea for most things. So that was one bit of advice, I think, is just be careful about trying to pick types of operations. Now, we're a little bit guilty of that because we do say things like diamond rhinoplasty, or preservation rhinoplasty, but these are actually genuine researched advantages and developments which our group have pioneered. So that's the little international rhinoplasty research group that we're part of, and I see several names popping up here of colleagues or friends of ours. But we only put things up where we know we've tried and tested, it's been researched, it's been published, and that we know it has a benefit. So none of those are sales issues.
Indeed. There was another really important question. How do I know whether the result on the simulations and morphing is going to be the result I'm going to get? Well, I think the simulations are fantastic. You love them, we love them, because it's a means of communicating. It's a means of explaining what it could potentially look like. It's a means of you seeing yourself with a different aesthetic, the nose, how does that suit your face? It's a means for us to think about what technique we can do to achieve that result that you would like. It is the best for communicating because it gives you a visual. Charles, I think, would say that most of the time you get pretty close to what the simulation is.
Yeah, I mean, I think simulation is great, but the trouble is it is only a tool, and it's only as useful as the person who's doing the morph in terms of what he thinks he can achieve for you. So it's very easy to create perfect noses in morphing, but they're not realistic. And I think one of the issues is, remember that a tool is a tool, and it can be operated by an experienced person, or you can have a fool with a tool. Sorry about the alliteration, but it is true. And I think the more experienced you are, understanding how skin settles, how a type of nose will evolve, you can then, and this is what I mean about following your patients up and seeing what the outcome is over a long time, because that builds up an experience which allows you to be really honest and genuine about what you think you can do and what you can't do. So I think morphing is a great tool. Please don't be seduced by this fancy, 3D morphing is better, because that's very often not, that the algorithms still don't work that well. The best is a face-to-face with an experienced surgeon who is used to doing still two-dimensional morphing. 3D morphing will get there, but for the nose it's actually quite difficult to get a three-dimensional change about what will actually happen when your nose changes. So we do agree with it, we think it's great. Unfortunately, some of the morphs that you see, well, are probably a little bit too ambitious, or actually what happened was the operation didn't actually follow the protocol that was needed to create that picture, to achieve that picture. So they just did a standard operation, but having done a morph. Right, someone else wants to know about Carlos Neves.
We cannot comment on individuals. I don't think it'd be professional for us to say who is really good or who is not that good.
Well, people who are involved in some of the academic institutions, such as the European Academy of Facial Plastics, the Rhinoplasty Society of Europe, are all, and if you find people who are presenting there, then they have certainly reached a good standard. And definitely the people that teach and lecture tend to be much more focused and intuitive about what needs to be done. So by and large, I don't think you'll go wrong with referencing people in those sort of groups.
So someone is saying that that had a septoplasty, like an operation to the middle part of the nose, and after septoplasty surgery, her nose changed and therefore needed 3 more operations after that. So I'm really sorry that you've had such a bad experience. The question was, should I go back to the same surgeon because he or she would know what's in my nose? It's already happened that he or she's been there, and should I trust that surgeon to yet again try a 4th operation? I think the question really is that surgeon competent to put it right after the third time of trying? And I think it might be time for his or her involvement to be with another colleague. We all have colleagues that we can refer to and ask for help sometimes. There is no embarrassment in asking for help when help is needed.
No, I think that's true. And unfortunately, sometimes experience with someone is the confidence to keep on making the same mistake. And what to tell
We are really experienced.
One of our mentors used to say it's a bit like marriage. The chance of success goes down with each repeated attempt. Sorry, that's not a very good thing to say. But in essence, it's true. And I think if you've had 2 goes at something, then it's always worth saying, look, this isn't right. Perhaps can we engage someone else? And most of us have colleagues that we will refer or suggest you just go and see. There's no harm in that at all.
When we say how a nose evolves with time, after an operation, the initial result, a week or 2 weeks later, you can tell the change and how it's happened. But that, I think it's obvious, it's not the final result. So all the tissues need to adapt to the new framework. So that's what we mean when we say how the nose evolves.
Yeah, we call it a journey. And I think it's a good idea to think of it as a journey, because I often say to patients, look, we've done a morph for you. This, you're not going to look like this in the first 6 or 7 weeks. Please, you're not. And certainly, particularly for the skin in your nasal tip, that often takes a long time to settle. And the thicker and more oily the skin, the longer it takes. So understanding that journey, and I often say, those of you who may know me say, look, it's not 1 week, it's not 6 weeks. But we know that there is a process of settling, refinement and definement that will go on for months, sometimes a year or 2. And I've got a very nice identical twins who I did surgery on, and they both had slightly different techniques, got similar results, and I followed them for 2 years. And it is remarkable when you see what happens. And it's difficult because young people want the result like this tomorrow. But the thing is to understand, look, you are in an evolution, a journey. We'll hold your hand through it.
I just want to say hi to the stylist London. I just saw you popping up. Hello. I hope you're all well.
Yeah. So that's another thing as well, is, are you going to be cared for in terms of, ask someone what sort of follow-up and what the issues, and they should spend the time explaining that to you.
And there is, Rockstar says, the website Real Self is an honest place to check for reviews. It is an honest place to check for reviews. We've got some wonderful reviews thanks to all of you happy patients of ours. There's only one thing I would say, that the review should not be forced on patients. We've heard some doctors asking for a review immediately with a little bit of an exchange of something else, so we don't do that. But it's truly genuine that the website Real Self is from patients.
Somebody asking, can rhinoplasty go wrong after years? What happens after an operation is your nose does go through a change. And I think one of the things we realise, and why a lot of people get into trouble, why their nose looks worse, is the frame of the nose is overly weakened and destabilised. And then what happens is the skin envelope tightens down and it causes the asymmetries and twists. And I think that's the fundamental issue that we talk about in preservation, which is one of the modern ways of doing rhinoplasty. So that over time, that we don't take away the support or the frame of your nose. And that means you get very little tissue removed, we change the shape of it, we reorientate it. But that means you also have stability, and that with nothing's taken away, then there's not a huge amount that's going to twist and change with time. Now, we all get older, and our noses and our skin change as we get older, so there's a natural process. But what we don't want to see is at year 2 or 3, if you've had an operation in your teens or your early 20s, you then have to come back and have to have a rib graft because everything's been taken out of your nose.
That's actually the big problem.
That's a big problem.
If
So the 30-minute rhinoplasty,
exactly,
you can do a lot of damage to a nose with a quick rhinoplasty.
30-40 minutes operation, a lot of damage can be done because all that is done is take away bone, take away cartilage, and then the nose is weakened, and it doesn't look natural. It doesn't look right.
Most specialist surgeons will spend at least 2, sometimes 3 or 4 hours in terms of technically getting in the right plane, preservation, doing the operation. So the quick operation that's tagged on the back of, say, a septum operation, don't do that. If you want to have your nose changed, go in, to be honest, right at the beginning, said, I've got a deviated septum, but I want my nose to be properly repaired. Never think of it as a little add-on. That often ends up in a disaster.
There is a question about whether relying on qualifications alone is the only thing. Clearly, qualifications are important. That surgeon has to be qualified and specialized in doing what he or she claims to be doing. However, like in many journeys in life, I think there has to be an understanding. There has to be good rapport between the surgeon and yourself, and that rapport has to go both ways. We have to really understand what you need and want, and we need to be honest as to how much of that can be achieved. So qualification is essential, but something else needs to happen. Qualifications alone, I wouldn't say would do it.
No, qualifications, experience,
Rapport.
and almost like a little bit of proof in different scenarios. So you can find comments about various surgeons on different platforms, be it Insta, be it RealSelf, be it on Google.
I'm just looking at some of the questions that are coming up. Is it possible to achieve similar to what your birth nose looked like from the front after being unhappy with the primary? Research Rhino. A revision, i.e. another operation, will never put the clock back. I think we've got to be honest with that. And a lot of times, especially emotionally, when something happens that upsets us and disappoints us, all we want is to just turn the clock back and to not have made that mistake, to go back to what it was. That is not possible. We are where we are, and we can only look forward. So sorry, Research Rhino, you cannot turn the clock back, neither you nor anyone.
But you can certainly, I mean, if you've got widening or asymmetry of your nose when you see it from the front, we can rebuild it to create nice shadow lines, but it's very difficult to go back to your original.
How much of the dorsal extension can one get after removal? How much of the dorsal extension can one get?
I presume you mean by that your nose is shortened, it's been turned up too much?
Or over-scooped?
Or over-scooped?
There are plenty of techniques to make it look more natural if that's the problem.
They all involve using a graft to do that, though. Again, it's the frame. It's like the tent. If the frame of the tent has been weakened or damaged, so who's better, Dr. East or Lydia?
It's funny. Hang on a minute. Why is he Dr. East and I'm Lydia? Dr. Charles East and Dr. Lydia Badia. No, I'm joking. No, he's much better. Definitely much better.
No, it's a complementary team. We're both good at different things. So, look, Jose's just arrived. Hi there.
Hi. They were asking about you.
Oh, yes, look. So did you say Dr. Carlos is in line? Yes. I think he is. All the way from Portugal. Hope you're still locked down.
Keep safe. How are you all doing? And then, can a crooked and dented nose be straightened without grafts if the septum is intact? That's quite a nice question, I'd say. So grafts, so that we know what we're talking about. A graft means when a piece of tissue is taken from its original place and placed somewhere else. And that graft has a donor site, i.e. where is the tissue taken from. And if it's taken from the septum and put somewhere else in the nose, that is considered a graft? I hope that answers the question.
Can a crooked nose be dented? Can dented nose straighten without grafts if the septum is intact? Yeah, using local tissue if we can. That's always what we do. Otherwise, you have to look to ear or possibly rib. It depends what caused the denting in the first place. How can I book a consultation with you? Well, please do email office@eastonbadia.com, or you can call us. Our telephone number's on the website. At the moment, we're only doing e-consults, but hopefully when the lockdown finishes, we'll be able to start doing some more face-to-face.
I love you, Harper.
I think Leah's fan club signed on board, and I so
No, you are the best patient.
right, okay. Right, thanks for your answer. Didn't touch much, take away, no guitar. Such a huge difference. Right, how much is rhinoplasty? Do have a look at our YouTube channel. We've got sort of information on those sort of basic questions like cost and what to do and downtimes.
Another nice question, is there a reason why you don't use sedation instead of full anesthetic? Yes, it's a very good reason. We believe a full general anesthetic is safer for you. We work with wonderful anaesthetists. We've had the same team of anaesthetists for I cannot remember how many years.
A long time.
I have trusted them to put my daughter to sleep.
So I must answer that question too, because in my training in Seattle, I spent a year out there. I did about 100 rhinoplasties under local anaesthetic and sedation, and I vowed never to do them again. There are circumstances where you can have local anaesthesia if it's something small around the nasal tip. Twilight anaesthesia or sort of intravenous sedation, it takes longer. It's not as easy to control the environment where we work. It's not quite as safe because your airway is not protected. And I think in the reasons that we get great results now in surgery is that the conditions and the environment we work in make it such that we can be very precise, we can be very accurate. And the operative field means that we don't get big bruises, you are safe, you're totally monitored, you're in the right environment. And if there was some sort of abnormal reaction, it's easy to deal with. Plus, it's very difficult to lie still for 2.5 hours.
That's exactly how long the operation takes. First operation on the nose, it's between 2 and 3 hours, 2.5, 3 hours. It's not 30 or 40 minutes, that's for sure. And the question was, does a revision surgery take longer than that?
Yes.
And absolutely it does.
I think it's worth just pointing that out, is revision rhinoplasty is a completely different ball game to primary, both from a psychology point of view and from a technical point of view. And you need to qualify that because there are easy revisions where maybe the operation hasn't been completed properly, and then there's the complex ones where we're sometimes having to rebuild, reorientate, and reconstruct. And those are the ones that need a higher degree of skill, a longer time, and are just more difficult.
We do those type of cases together, but Charles is the main captain of that ship. I cannot do this type of complexity. It requires a lot of precision and a lot of skill that is difficult.
Can we
to
rebuild retracted columellas? Yes, of course, obviously.
Yes, Mandy. So earlier on we were saying about the actual technicality, and I remember there's another question about the tongue and groove, which maybe a lot of people are not sure what that means, but it's not uncommon that one of the errors is to have a shortened nose, which is over-shortened, and then the nose to retract it. The columella is this skin in between the nostrils that has sometimes gone in. Anything is possible depending on what the problem
and going the other way,
caused by.
Can a tongue in groove and septal extension graft be removed? Well, the tip can be released from that and brought down if your nose has been lifted too far up. Yes, indeed. Wide and narrow. Can you widen and narrow down?
Widen and narrow down.
Not sure. Mandy, try that again.
Oh,
My tones are too narrow.
Now we got it.
Yes. So if it's become very, very pinched or narrow or pointed, yes, of course, those can be released and then rebuilt to give a smoother, adequate width
Just
in relation to
softer.
your face. Yeah.
Yes. Overscoop, that's right. It's one of the commonest errors is an overscooped nose. How come they seem to make the most dramatic changes to the nose abroad or able to make it smaller abroad in comparison to the UK? Hi, Kimberly. Yes, it's a good question.
Depends what you mean by small.
Well, I think it also depends on the expectations that you might have. A lot of our patients want a natural result and they don't necessarily want a small nose per se. They want a nose which looks well balanced, that it suits their face, and that doesn't always mean that it has to be a really small nose.
Yeah, it's possible to change a lot, but the most important thing is to understand what each individual wants. So if you're relatively short, if you're 5 foot, 5'2", you can afford to have a low bridge and a small nose. If you're 5'9", then the last thing you want to do is have a nose that's high and turned in. So it also, there's an ethnic flavour. There's, where you come from. Are you Northern European? Are you Mediterranean? Are you Arabic or Far Eastern? So all of those sort of styles or ethnicities are important in terms of making noses that look natural. We can do most things, but what we try and do is listen to what the patient says. And I think coming back to our questions about what happened before, if your surgeon's not listening to you, or you've got a problem and that you're being brushed away, we were trying to think about what sort of questions you might sort of ask. And so if they say, no, it's fine, but it's not, you can ask them, well, look, okay, if you think it's fine, are you happy for me to post my pictures all over the internet and say it's your work? And then see what the response is to that.
It's a good question. There was silence.
If you've got a surgeon who is listening to you and understanding or even repeating back what your questions are, that's good. That sort of idea of reflecting listening is important, and that really gives you enough time.
I'm trying to find more of the other questions. I'm so sorry. Mandy, can you reveal my scooped bridge?
Yes, that needs an augmentation, and that's a graft process.
You see how they use, I love it how all of you use technical words. Can you create the dorsal aesthetic lines?
Yeah, so those...
maybe some people don't know what those are.
So the normal shadow lines are these lines that come from your eyebrow down to the side of the nose and should end up in a nicely defined tip. No, I don't have a nicely defined tip. Lydia does. But those
love your tip.
Those little shadow lines are what we're referring to as the dorsal aesthetic lines. These curving lines from a brow. And in a lady, they should be a gentle fusiform shape. And if the hump's been cut off and the nose has gone flat, they disappear or they look washed out. So rebuilding those in the same way that we shape a tip involves putting something in to create a little bit of tension under the skin. So that usually means us using a form of graft that gives that little shadow when the skin settles on it. Then you have these nice aesthetic lines. You'll see that in some of the revision patients that we've posted, how we've created nice aesthetic lines. Okay, saw you for the first consultation. Hoping to get back in July. Still experiencing a lot of pains. Okay, fine.
Well, I think you should maybe message us directly, and we can, if you've already been a patient of ours, we'll find your file and we can arrange for any scans or anything.
Either contact Julia, our practice nurse, or office, and we'll sort that out. Do you take from patients abroad? Yes, of course we do. We treat patients from all over the world. Does grafting to support the nose to be straight and make the bridge wider? No, not necessarily, it doesn't. Can I have an appointment if I have nose filler? Yeah, that's a point. Is people who go through a non-surgical treatment for the nose. that can be quite effective in terms of changing particularly your profile contours. It doesn't work very well in the tip and it's dangerous. So if you've had a filler, then we normally like to dissolve that out. Fillers last a very long time in the nose, and it's difficult to sort of kind of guess what you need if there is still filler in your nose when you come for a consultation. But ideally it's best to have it dissolved.
I've given you this question before. My eye inner corners move in when I breathe in and move out when I breathe out. Is it dangerous?
No. What it means is there's a contact between the internal nasal lining and your skin. So that means there's a little deficiency in the bone area there. And that when you breathe, the side wall is just very, very slightly moving with the airflow. It's not dangerous. Do you operate together or separate? Well, sometimes we do and sometimes we don't.
We operate separate and together.
Yeah. What proportion is your basal med? Probably about 30%. It varies, but around about, I would say, sort of 2 to 1 in two ladies to one gentleman.
Different approach to male and female noses. No, the approach is depending on what that patient wants. Male noses, if they want to remain male, have different characteristics to female noses. Listen to the patient.
Yeah. So yes, it's a tailored operation, rhinoplasty. So it's individual, not only for sex, but also for person and face shape. And can filler be used to temporarily build up the nose while awaiting for surgery? If long, okay. In general, if you need a revision, it's not a great idea to think about a little short-term fill. Injectables are not without some risk, and if you're committed to having revision surgery, it's probably best not to do it. If there's a problem that for whatever reason you can't go ahead when you want to, then you can certainly have something temporarily, but you'd need a dissolvable or a removable filler rather than anything that was semi-permanent. Normally, if you have fillers, I've taken fillers out of people's noses 2-3 years after they've been injected, but normally we would say that that's dissolved out. It should be done at least 10 days before your operation. And there's a little bit of inflammation that happens when you dissolve it out, but just let your tissues settle.
Yeah.
How long do you soak the rib cartilage in saline?
Ooh, we don't soak it in saline.
Okay, that's. I think that's really just alluding to ribs and how they can sometimes walk. We have many technical ways in which we can deal with that.
So, all these messages, one thing that I feel comes across is how difficult it is for you, some of you, that have been disappointed with the result, and what a lot of courage it takes sometimes. It can take years, it may never happen. It can take a lot of courage to actually trust someone else to do it again. And with that courage, sometimes one feels have to take control of, because how can you trust someone again? You did that the first time and it didn't go well. So you now want to be in control of everything that is going to happen, and that can sometimes put us in a, well, I don't do the revision, so that's fine, but it can put you guys in a difficult position. Obviously you need to understand all the risks involved, but I think it's probably not in your best interest to try and do the operation yourself, to try and be so specific about the technique or which solution do we soak the cartilage in. It may not be in your best interest as a patient that ultimately wants a lovely result.
I'm hoping that the people making comments on here are
all of your past patients,
because their questions are a bit worrying.
Oh, give us some questions then. Give us some more.
Can sidewalls be brought back out where they were before surgery in the bridge wires? Yes, indeed. If you've had the nose over narrowed, indeed, you can move that out.
Ideally,
my tip to points were.
Ideally, you would have your primary operation with someone that understands, you have a lovely result. And some of our lovely patients, we become lifelong friends and they blossom, everyone's happy. The reason we wanted to do this Q&A on patients that weren't in that position, unfortunately, is because we've realized sometimes patients who are unhappy feel a bit isolated. They feel there is no one that really understands them. They're not sure who to turn to or whether they can even trust anyone again. So we thought giving you guys the opportunity to just air up some of the issues that happen, you might be able to create, I don't know, a chat amongst yourselves so that you can discuss what bothers you, whether it's something you want to do again. I just thought it'd be a nice way for you to get some support.
Okay, can we widen domes that are too narrow? Yes, that's a
I
tip.
think, Mandy, you've asked that already, yes.
Can you help rebuild? Yes. Okay, same above, building the bridge. Yeah, building a bridge up from a over-reduced nose almost always needs a graft of some sort. Yes, so it's possible to do that. Sidewalls, piezo tools. Who's that? My sidewalls were reduced too much by piezo tools. Can you apply crushed cartilage?
The side walls, please, to
Yeah.
replicate a natural looking nose.
Okay, sorry you had that, Mandy. Yeah. Yes, it's of course. Dome suturing be undone. My tip defining weight. Okay, so yes, you have to pick.
We like, by the way, revision rhinoplasty 2019. We did like. I mean, your questions were really very genuine. Thank you. Oh, rock star! You are a rock star.
I love the diamond tip, like the triangular ones. Okay, good. Yeah. It's really cute. There's never anything about me, is there? So,
you are cute too.
No, I'm not supposed to be cute. Hi, question please. How long on average to wait from your initial consultation? I've heard it can be up to half a year. Well, it kind of really depends on.
At the moment,
we don't know what's going on at the moment because it's gone on longer than we thought. We're going to be guided by how the government unwind and prioritise surgery. There's going to be a limitation in theatre time because all of the specialists for non-urgent surgery have got similar problems. We'll do our best, obviously, but we're going to have new guidelines with COVID testing. We're just in the process of designing protocols that we're going to have to go through to minimise your movements because this virus isn't going to go away in the short term. Sometimes,
but we are not going away either.
Sometimes we can operate at usually about 4 to 6 weeks notice. It very much depends on what you need doing and scheduling and things. So it's variable, but
I think the world will be a different place for all of us, and we will see what that looks like.
Why do surgeons not tell patients their nose will never feel like a nose again? But it'll be hard. It's very life-changing. Well, feels like a prosthetic. That sounds like you've had some grafts put in there, GSP 0202. I think we always say that after surgery, you're going to feel unusual. Your nose will feel numb, it'll feel woody, it'll somewhat feel artificial. And depending on what's been done inside your nasal tip, it may be harder than it would have been naturally. So that's often dependent on the technique that's been applied. In the majority of operations that we do, that sort of stiffness becomes less over months, but there are certain types of technique where it will be permanently harder than it was as an original nose. Most of them retain their sensation. Is it in order to get a fishy smell? Yeah, so fishy smells are not uncommon. Don't worry about them. They are often related to some little stitches that haven't dissolved. And sometimes an antibiotic cream will help those, and often using a bud with some antiseptic inside the nostrils will get rid of that odour. Okay, how much the bridge augmentation? Okay. Why should your nose not have feeling post-op? Well, you do get, in any approach to the nose, you will divide or sometimes interrupt some of the sensation nerves. And if you have an open approach, that is where there's a tiny incision under the crease here, then the numbness is usually more than if you have a closed approach, that is. So that's a small trade-off. In almost all cases, the nerves should regrow so that the area of numbness gets smaller and smaller over time and should come back to a normal sensation.
No, Amalia.
Amalia done. Okay. Second, praying a lockdown doesn't cause no. Yes, good to see you, Amalia. How do you fix a bossa? No, filler's not good, I'm afraid. Bossa, let me just explain bossa. Bossa, instead of having a nice smooth curve to your cartilage, what happens is, if the cartilage isn't strong enough and the skin is contracting, you get that effect. It creates a knuckle. And it's almost always a complication of over-resection, too much tissue taken away, or creating too tight a dome point with stitches. And what happens is the cartilage crimps like a knuckle, and then will often push out a little bit. So with a curve, when it crimps, it sticks up a bit, and that's what often gives a little white highlight. They're difficult to deal with. They really need the cartilage unpicking and often a reconstruction. So you have to put another little graft in there to get the shape. It's almost impossible to cure those just by shaving them off. They sometimes just seem to recur. They are fixable. Filler, not a good idea after rhinoplasty in your nasal tip. Do you use solid grafts to rebuild? We use a whole range of different things. Yes, we use platelet-rich fibrin, we use fascia sometimes, we use perichondrium, we use dice cartilage, we use solid cartilage. It depends on what needs to be done for your nose. Is it easy to derotate a previous? Yes, it is. Lengthening your nose, bringing it down. You'll see several examples of our patients where we've done that in revisions. Thank you for your answers. Reduce the droopiness in the skin between your nostrils when having a revision. The droopiness in the skin, yes. Yep.
That's the
hanging columella.
That's the funny name that we give it. Columella is that bit in between.
So if this is drooping and hanging down, that usually is one of the error patterns that we see quite commonly in rhinoplasty. I'm not a past patient. If you get surgery on a deviated septum, could your nose deviation go back normal or get worse? If the septum deviation is purely at the front and cartilaginous and it's put back and fixed, it's very uncommon for that to move. If the deviation is part of a more general twist in your nose and those other elements like the bones are not released as well, then it is possible that your deviation can recur.
Hello,
the Aesthetic Club in London.
We love you.
Vladimir Gregorian said he's the world #1.
Oh, marvelous.
Gosh, well, he's got a
whatever
good opinion of himself. What are the chances of rib or ear cartilage warping over time? This is my concern for revision of the grafts.
Fair enough.
Yeah. So I have very uneven nostrils after my rhinoplasty. Yeah, that's not uncommon. That's another common problem, even for all of us. It's a difficult area. It depends on what's happened. A lot of times we can get that improved. We often say to patients, look, this view, I mean, I'm not symmetric in the base, and I've not had surgery, but sometimes you can get them better. You may never get them perfect, particularly if you've got a little bit of facial asymmetry in the upper jaw.
I actually think this lockdown is not good for us looking at the camera all the time.
Yes, when you have a laptop open, the camera's shining out, so the view's always this way. That's why we get the cameras lifted, the heads down.
It'll give us.
And then you get a double chin. Should primary rhino surgeons cover the cost of revision if they're doing it? Good question, T.S. Finn. I think you have to ask your surgeon what their policy is in terms of how they manage revision. That's a very individual thing. I mean, I can tell you what we do is if there's a technical problem, we normally say, okay, you'll still have to pay a discounted facility charge, but we'll normally do that for nothing extra. If this happens a little bit like 2-3 years down the line, you say, I want a bit more here, a bit more there, then that's obviously chargeable. Does extending tip mean base will narrow? Nope, it doesn't. Hi, question please. How long on average? Okay, up to half a year. I think we've answered that one.
Yeah.
A Advice with choosing a surgeon for a person that's never had rhinoplasty before. Arab nose.
Well, the point about doing these Q&As on some of you who have been unhappy is to perhaps give your wisdom on where do you feel you went wrong, so you can help others who are looking at having their first surgery, and perhaps giving them on the internet. If you want to remain anonymous, that's fine, but the main point I would say is try to help others. Don't stay in your own shell.
Maybe we should just say what in the last few minutes before we have to sort of wind up what we think.
Yes, go.
You far away. No, Lydia's
No, I would love at the end of the day, when I've made a mistake, after my time of realization and feeling stupid, I feel that okay, I come to terms with it, I do something with it or not, and then I try to help so that others don't make the same mistake I made. So maybe consider others in explaining to them, if you were to do it again, knowing what you know, how would you do it differently?
So I think Insta's a great media. I mean, it gives you access to people where you can independently message people. I think there's a lot of information out there. It's worth looking in different sort of fora to see whether there are consistently good or consistently bad reviews. Do obviously discuss with friends. If you can talk to someone who's had the surgery, that's often quite helpful as well. Please don't be seduced by offers or price on its own, because that will sometimes lead you down a pathway where you may not get the right person. And Lydia often says to me, look, if you want something special, like a special handbag, you keep telling me, you sometimes have to save up a bit for it. So I think in terms of that time, if you think about that, is actually just spending the time, discuss it with your friends, talk about it, be open, and make sure that you're building up a sort of a social proof, or as it were, a professional proof, whoever you're going to see.
It's been so helpful that you send us all the questions, and I know we've not covered every detail of all the questions you DM'd us before, but hopefully it'll help us also to get an impression of where can we improve so that the problems that you have had are not repeated.
How do you know if there's a scar tissue left post-grind that's making the nose bigger? That sometimes needs an ultrasound scan to see what's going on underneath the layers of the skin. Can you build a bridge up?
Might be out of time.
Yeah, I think we're not far off actually. Vision, thanks so much. That's very nice of you. Okay. When using dermal fillers, how is this replicated in rhinoplasty? Well, easy.
Oh, I saw revision right in 2019.
Mm-hmm. Okay, how is that replicated in surgical rhinoplasty? Well, we use a form of graft, either soft tissue or diced cartilage, or one of the other types of graft that we use. Seem I have a bump still, but supratip break. Okay, could this be corrected? Yes, that's a very easy thing to deal with if there's a little bit of a bump.
Oh, there we are. Not at all. You're welcome.
Adam Holland.
I'm a pass. Oh.
Okay, confident you can fix the trauma.
Oh.
Yeah. Okay, yeah, of course, absolutely we will.
Adam.
You're really amazing. Oh, there we go. Definitely book consultations. Very much looking forwards. Do you do Skype consults? Yeah, we do. We use the Top Doctors platform. If you want to do an e-consult with us, you need to contact our office first, and that's kind of set up. It's a very secure platform, and one which works really well.
There is no other way of consulting at the moment.
We don't do consults over Skype or Zoom, just because of security issues. So Top Doctors is the platform we're using at the moment.
But we've got a minute left, I think.
How close do you achieve your results in comparison to your morph? Well, pretty close. I mean, I'm pretty close to my morphs. It's very rare that I don't get close to what I've suggested. Okay, Nistel, okay, I'm sure. Proceed, can I confirm? Yeah. Of course you can progress with us when these times get better. Bad experience. Okay, sorry to hear about that, Sean. Mandy, okay, can you remove articulated rim graft safely? Yes. So we've just now, I think, come to the end of this, and
Until the
let's basically say thank you very much for taking part in this. We hope it's been useful. We want you to stay safe and happy, keep smiling. We'll still be active on social media, and we'll let you know when we're able to restart.
and
Anyway.
for now online.
Bye bye, everybody.
Thank you for joining us. See you soon.